In the name of God, hello everybody. This is MAHBOOBEH Maazallahi, MSc in Critical Care Nursing, Structure of Nursing School, Razi Faculty of Nursing and Midwifery, KERMAN, University of Medical Sciences, KERMAN, Iran. My presentation is about the impact of COVID-19 outbreak and nosocomial infection rate, a case of Iran. Coronavirus disease 19, COVID-19, is a new type of coronavirus that has caused a global pandemic. COVID-19 is highly contagious and is primarily transmitted through respiratory droplets and close contact, and all individuals are susceptible to the disease. Therefore, extensive measures were taken to prevent the spread of the disease at the community and hospitals. For nosocomial infections to be prevented in health centers, infection control standards were used, such as provision and proper distribution of equipment, triage strategy, congestion reduction, the organization of wards, and environmental health, and training and implementation of standard precautions such as safe injections, hand washing, and personal protective equipment. Nosocomial infections are mostly prevalent in the intensive care units and in older adults with underlying diseases and suppressed immune system. They cause several problems in the treatment course of patients, including the high cost of laboratory procedures, the use of medication, the length of hospital stay, and antibiotic resistance. Regarding the importance of nosocomial infections and pandemic of COVID-19, this study was conducted to investigate the impact of COVID-19 outbreak and nosocomial infection rate. A cross-sectional design was used to investigate the nosocomial infection rate during and before COVID-19 outbreak in an educational hospital in southeast Iran. The study sample was all data related to the nosocomial infection rate of critical and intensive care units and medical surgical units in the first 4 months of Iranian New Year, which was during the COVID-19 outbreak and before the COVID-19 outbreak. Infection control was evaluated based on the Iranian nosocomial infection surveillance system, which was launched in 2006. Data collection on nosocomial infections was performed by an infection control team consisting of a nurse and an infection control physician. After obtaining the code of ethics and getting permission from the head of the hospital, data related to nosocomial infection rate of the CCU and ICUs and medical surgical units were gathered from the hospital infection control unit. Frequency, percentage, confidence interval, percentage change, Pearson's chi-square test was used. The results of the study showed that there was a 19.75 point decrease in the total rate of nosocomial infection during the COVID-19 outbreak. There was a 39.12 point decrease in the total rate of CCUs and ICUs nosocomial infection during the COVID-19 outbreak. A 19.23 point decrease was also observed in the total rate of medical surgical units nosocomial infection during the COVID-19 outbreak. All kinds of CCU and ICU's nosocomial infections had between 31.22 and 100 point decreases during the COVID-19 outbreak. Among medical surgical units, 33.33 and 30.70 point decreases were observed only in urinary tract infections and surgical site infections, respectively, during the COVID-19 outbreak, while bloodstream infections had a 40-point increase during the COVID-19 outbreak. This present study showed that the proper implementation of infection control protocols during the COVID-19 pandemic seems to reduce nosocomial infections. Therefore, nosocomial infections can be minimized by increasing awareness, creating a positive attitude, improving staff hygiene behaviors, and providing facilities to comply with the standards of infection control protocols. Thank you for your listening.